Okay, so ready for a deep dive into severe malaria in the ICU. We're talking way beyond just a fever here.
Yeah, you're right. This is the critical care side of malaria, not just a few chills.
We've got some pretty intense research and guidelines to unpack. Should we jump right in?
Absolutely, let's do it.
Before we get lost in the weeds of the ICU and all of that, let's start with the basics. Malaria. What is it exactly?
So malaria is caused by a parasite, Plasmodium, and you get it through mosquito bites.
Okay, so mosquito bites, parasites. But there are different types of malaria, right?
Right, there are. And the one that's most likely to put someone in the ICU is Plasmodium falciparum. It's the most dangerous.
Plasmodium falciparum. That sounds pretty serious. What makes it so much worse than the others?
Well, for a few reasons, actually. It multiplies much faster than other types, so it overwhelms your system quickly.
So it's fast acting.
Yeah, and to make matters worse, it can clog blood vessels in the brain, kidneys, lungs, vital organs.
So your whole body's at risk.
Exactly. It's like a system-wide meltdown.
Wow. No wonder it's the biggest cause of severe malaria cases.
And that's where the ICU comes in. These patients aren't just fighting the parasite, they're dealing with multiple failing organs.
So the body becomes like a battlefield.
Exactly. And the ICU team is like the frontline medics trying to keep everything going. Stabilizing organ function, managing complications, just buying time for the antimalarials to kick in.
Sounds like every second counts. Which makes me wonder, how do you even diagnose severe malaria quickly enough to get ahead of it?
You're absolutely right. Speed and accuracy are critical here. This is life or death.
So what's the gold standard for diagnosis?
Believe it or not, even with all our technology, it's still looking at a blood smear under a microscope.
Wow, really? Like old school detective work?
Yep, gotta actually see those parasites.
If that takes time, right? Are there faster options, especially in a crisis?
Oh, absolutely. That's where rapid diagnostic tests come in, RDTs.
RDTs.
Like those home pregnancy tests, quick and easy. They detect parasite proteins in the blood.
Much faster, I'm guessing. But are they as accurate as actually seeing the parasite? What if the tests aren't clear, especially in the ICU?
That's a great point, and it does happen. Sometimes the parasite levels are too low to be detected, or something interferes with the test. In those situations, especially in the ICU, doctors turn to more advanced methods.
So what are these more advanced tools, and what makes them so effective in these tricky situations? So what are these more advanced tools, and what makes them so effective in these tricky situations?
Well, one of the most powerful is PCR.
PCR, as in polymerase chain reaction.
That's the one.
I'll be honest, I know that's a big deal in medicine, but I don't really get what it does.
It's like a super-powered microscope that can find even tiny bits of the parasite's DNA.
So even if it's hiding, you can still find it.
Exactly. And not just find it, but identify the exact species, and even if it's resistant to any drugs.
Wow, that's incredible. So PCR can tell you which drugs will actually work.
It's a game changer for treatment decisions, for sure, especially in severe cases.
So once you've got a diagnosis, then what? It's time to fight back, right?
You got it. And we hit it hard with antimalarial drugs.
Is there like one miracle drug for malaria, or is it more complicated?
I wish it were that simple. We actually use combination therapy, especially for severe cases.
Combination therapy. What's the logic behind that?
Well, if you only use one drug, the parasite can develop resistance, and then that drug's useless.
So it's like a strategy to outsmart the parasite.
Exactly. Keep it guessing.
So what are the go-to drugs in these combinations?
The most common are artemisinin-based combination therapies, ACTs for short.
ACTs. Okay. What's in those?
They combine an artemisinin derivative, which works super fast, with another drug that lasts longer in the system.
So it's a 1-2 punch, knock it down, and then keep it down.
That's the idea.
Why is artemisinin so effective? What's so special about it?
It actually comes from a plant, sweet wormwood, which has been used in traditional Chinese medicine for ages.
Wow, really? So how does it actually work against malaria?
It basically creates free radicals inside the parasite.
Free radicals, those are bad, right?
Usually, yeah. But in this case, those free radicals mess up the parasite's insides and make it self-destruct.
So the cure comes from nature. That's amazing. But you mentioned a partner drug. Why is that necessary?
The partner drug is like the cleanup crew. It makes sure any remaining parasites are wiped out, and it reduces the risk of resistance to the artemisinin.
So you need both for a full victory. What kind of drugs are these partner drugs?
One common one is pyrenoridine, been used for decades, especially in China.
Okay. And are there others in development?
Oh, absolutely. Research is always ongoing to find new and better partners.
Makes sense. You got to stay ahead of those evolving parasites. But let's not forget, we're talking about severe malaria in the ICU. The patients are in critical condition. How does that change the treatment approach?
That's a really important point. Antimalarial drugs are crucial. But in the ICU, we're also talking about intensive care for the patient's organs.
So it's more than just the medication.
Absolutely. It's a whole care plan. Fluid management is a big one.
You mean making sure they're hydrated? Seems pretty basic.
It is, but it's also tricky.
Yeah.
Severe malaria can damage blood vessels in the lungs, make them leaky. Too much fluid too fast can cause fluid buildup in the lungs, which is really dangerous.
See, it's a delicate balance.
Exactly. And on top of that, we're also on the lookout for anemia, kidney problems, seizures, low blood sugar, even coma.
So many things to manage at once.
It's a constant juggling act, monitoring and adjusting. And even then, there can be complications, even from the medications themselves.
You're talking about PADH, right? Post-artemisinin delayed hemolysis. What is that exactly, and how does it complicate things? You're talking about PADH, right? Post-artemisinin delayed hemolysis.
Right.
What is that exactly, and how does it complicate things?
So PADH is a pretty new thing. It's kind of a mystery still, but basically it's a delayed reaction to artesunate.
Artesunate, that's one of the main drugs in those artemisinin combinations, right?
Exactly.
So even the miracle drug has a dark side. What actually happens?
Basically, patients' red blood cell counts plummet, but it can happen days, even weeks after they've finished the artesunate.
Their red blood cells are breaking down, but that late after treatment, why?
That's the million-dollar question. We're still not sure about the exact mechanism, but it seems like artesunate kind of primes the red blood cells for destruction. They're left vulnerable, and then something triggers it later on.
Wow, that's a scary thought. So even with our best shot, there's still this risk we can't fully predict.
Yeah, it's a good reminder that there's always more to learn, and medicine is always about weighing risks and benefits. There's no easy answer.
Definitely. And speaking of challenges, we keep dancing around this issue of antimicrobial resistance. What's the situation there, really? Paint us a picture.
Okay, so imagine you're a doctor, but you're in a remote clinic, resources are stretched thin, a child comes in with severe malaria, all the classic signs. You give the usual antimalarials, the ones that always work, but this time, nothing. The parasite just doesn't respond. It's resistant.
That's terrifying. So the drugs just stop working, like what we're seeing with antibiotic resistance.
It's the same principle, and it's a huge concern. But it's not a lost cause. Not yet. We have ways to fight back.
Okay, good. So what's our strategy?
First, we have to use the drugs we do have wisely. Accurate diagnosis is crucial, so we're not giving the wrong drug, using the right combinations, and making sure patients take the full course so we don't breed resistant strains.
So it's about being smart and careful with what we've got. What else can we do?
Research, research, research. We need new antimalarial drugs, ones that work in completely new ways that the parasite hasn't seen before. And we're looking at new combinations of existing drugs, new ways to use them.
So it's like a constant arms race, always trying to stay one step ahead. Well, this has been quite a journey. I have to say, I've learned a lot about severe malaria today, and it's a lot more complicated than I ever realized. What's the most important thing for our listeners to take away from all of this?
You know, for me, it always comes back to awareness. Even if you think malaria is something you'll never encounter, just knowing about it, how serious it can be, that's huge.
Knowledge is power, right?
Absolutely.
Yeah.
If you're traveling, protect yourself, know the risks, and support the research, support the organizations fighting this globally, because it affects us all.
I couldn't agree more. It's been a fascinating and sobering deep dive into severe malaria, and I think we've all learned a lot today. To our listeners, thank you for joining us. Keep asking questions, stay curious, and we'll see you next time.